Ahafo area, which currently has to test samples in Accra and Kumasi. The executive director of the center, Dr. Kweku Poku-Asante, says they have the personnel and the laboratory space. What is required now is the provision of a qPCRO machine to test for the disease. John Sam Arthur has this report from the center in the Kintampo North Municipality of the Bono East region.
The Kintampo Health Research Center is a well-established facility. It prides itself on emphasizing African solutions to African health challenges. Kintampo Health Research Center is one of the 3 field research centers of the Research and Development Division, RDD, of the Ghana Health Service, established in 1994. The KHRC, as it is called for short, and currently it is the institution which is closest to becoming a COVID-19 testing center in the Bono East region that could serve Ahafo and Bono regions as well, and end the need to travel all the way to Accra and Kumasi to test samples for COVID-19. Currently, the Ghana Health Service in the Bono East, Bono region and Ahafo regions relies on testing centers in Accra and Kumasi for the COVID-19 efforts. But the President has already stated that efforts are being made to ensure that every region have at least one testing center. Here in Bono East, the Kintampo Health Research Center is the closest to that institution. We are here today to find out how the efforts to make this place a COVID-19 testing center is going. So we are going to talk to the director of the center, Dr. Kweku Poku-Asante, to tell us more.
In terms of our preparedness for this current outbreak, which is COVID-19 outbreak, we have discussed with the leadership of the Ghana Health Service through our regional director of health services. I think the government is reacting to the current pandemic and have decided to put in place some of these machines at specific areas. That is, I believe, is ongoing, as was said by the president. In terms of cost, I cannot put a cost to it at this moment. We're looking at our leadership to provide us with one and to get the testing going. We are talking about a new illness, a new virus, and so we needed to have them trained to be able to understand the protocols that are required for testing of COVID-19. So in terms of human capacity, we have the human capacity available that is trained. What is left is to have the machine that is required to test for COVID-19, and this is what we refer to as a qPCR machine. All other equipment are available, the space is available, the hood that is required to ensure the safety of the laboratory scientists who are testing for the virus is also available. And so at this point, we're looking for that support to establish the machine and then to do the testing. We think it's important at this time so that we can support with reducing the backlog that is currently being observed in the other places.
They have the personnel and they have the space. What is left now is that vital equipment called the OPCR, and they are hoping that the authorities, the powers that be, will ensure that they have it in no time to be able to start testing for COVID-19 and bring relief to the KCCR, Noguchi, and the Public Reference Laboratory in Accra. For GBC News, John Samantha reporting.